Bob Strupp, physical therapist.
Brad Heineck, physical therapist.
And together, we are the most famous physical therapists on the internet.
In our opinion.
In our opinion. Both got our Jerry Garcia tie on today, we're looking good.
Mm-hmm.
And Brad's got his pens in the pocket, which makes sure, he's a bona fide nerd. So I have nothing there. All right, we're going to talk today, Brad, about the pain scale.
Yes.
And there are different pain scales. In fact, I was reading on the internet that there really is no universal pain scale that medical practitioners are using right now.
Sure.
I think most of us tend to use the 0 to 10 scale.
Right. Very common.
And so that's what we're going to talk about today. Very simple scale. And why are you using this? When you're working with somebody, there's no wrong answer. So if I ask you, Brad, how much pain are you having? And I want you to rank it from 0 to 10.
It's 10, Bob.
He's having 10. See, what's going to happen now is when we treat him then, we hope that that number goes down. So it's all really more a matter of where are you in relative what you first talked about. So let's say the first time I saw someone they were a 5. If the next time I see him it's a 6 or 7, we know it got worse.
Right.
If the next time we see him it's a 4 or 3, we know it got better.
Right.
So that's really what we're looking at. And there's a couple other things we'll talk about as we move on here. But again, generally this is the guideline that we follow. Can you see that, Nancy, okay? So 0 to 1 is basically no pain. And when you're giving an answer to a pain scale, you really don't want to exaggerate.
Right.
You want to give what you really feel like you're feeling at the time. 2 to 3 is mild pain. 4 to 5 is discomforting or moderate pain. 6 to 7 is distressing, pretty severe pain. When someone tells me that they're up in a 6 to 7, 8 or 9, I'm saying that's bad, isn't it? It is, it's bad, it's especially. 8 to 9 is intense, very severe pain, and 10 is unbearable pain. What do you often ask, what do you say a 10 is? I mean, when you ask someone?
Well, yeah, first when I work with a patient, I'll go through this, I'll say 0 is absolutely no pain. 10 is extreme pain. If you're at 10, you are screaming, you are literally wanting to go to the emergency room. And that's why when you asked me before, I said 10 because I get that from people, so then I have to know, I have to explain what my 10 is so that
Exactly.
their 10, I mean, if you say 10 with me as a therapist, it's not my 10. 10 means that you are crying, you're ready to go to the emergency room right now.
And I think the other point I'll make with people is I say, how bad does the pain get at its worst?
Yeah.
And then how is it right now? So it might spike up to an 8 or 9, but it generally is at a 2 or 3 or 4 or 5. Because if it is an 8 or 9, it's unlikely that you could be functioning in public. There's just no way. The other thing, when I was kind of a rookie therapist, just to what Brad was speaking about, people, they try to exaggerate how much pain they're having. So a lot of people say 12 plus, and I had one lady who because she wanted to make it worse each time, she started getting up into 10, 20, 30, so she created a whole new scale. Now she was at 80 to 90. So you can't let them do that. I mean, 10 is the highest, and 10 is just, like Brad said, you're going to go to the hospital, it's unbearable. You want to keep them on a realistic scale. Yeah. And there's psychological issues often going on with people who say they're at a 10 or a higher, and they're looking at you and they look very comfortable. I mean, it's just...
Right, it's something a therapist or, people in this field have to deal with and understand and work with the person, so you get the information to help them out.
Another helpful pain scale is to actually using the little smiley faces or the sad faces. Can you get that, Nancy?
Here, allow me, Bob.
Okay, Brad's got his pointer, he's so happy.
Yeah, right here.
So you can see it kind of follows the same scale, but for people who are more visual, they can say, where are you on this scale as far as the happy face or the sad face? Right.
So if I'm doing this, I'm putting one more, this person's got an open mouth screaming and yelling for number 10.
And I think I've seen that actually too. Yeah. There's different ones. This obviously would work better with children too.
Sure.
And even maybe some of the demented patients, patients with dementia, it might work better. So, Again, it's all a matter of relativity, you know, if you start here, we're trying to get you down in here and not have it go up.
Right.
Any other things you want to mention, Brad, about the pain scale?
No, again, in general, when I work with someone, I get to the point now where a lot of times I won't use a pain scale. I'll just say, is your pain better or is it worse? And that's what I really need to know to treat them, if it's getting better or worse as a result of the
Well, a lot of
exercise.
times I will not tell them what they said the last time, because I don't want them, I want them to, you know, sometimes people start getting better and they don't realize it too. They'll say, I was at 8 or 9, and then like a couple weeks later I'll ask them, and like, what was I before? I was like, I won't tell them. And then they'll say, well, I'm a 4 or 5, because they are getting better, they don't even realize it. So.
Right, yeah, it's relative.
And
So,
Brad,
yeah, the infamous pain scale, and so hope this helps you out with when you hear that at the doctor's office and your pain scale, because a lot of people don't like it.
all right, thanks a lot.
Oh, sorry, you were going to get into the broken heart?
I was going to.
Yeah.
It's too late now, right?